The number of confirmed deaths from coronavirus infections in the UK has topped 150,000. It's the highest recorded death toll in any European nation. As the total of Omicron cases in the UK surges ever higher, the healthcare system is at full stretch.
Ambulances waiting to deliver patients to a hospital in North London. There's no space inside because all the beds are occupied by COVID-19 sufferers.
How long have you been waiting in the ambulance for?
I probably think maybe an hour. I mean, it is frustrating because I want to go in there.
Britain's hospitals are under pressure from record numbers of Omicron infections. Around 1 in 15 people in England are thought to have COVID-19. In London, the ratio is even higher.
Our ward is a 35-bedded ward, which was purpose-built during the pandemic to look after patients with COVID. Currently, our ward is full, and it's full with all patients with COVID.
Most of those needing hospital treatment have not been vaccinated against the coronavirus. This woman now wishes she had been.
I should have listened to all my family and friends, because everybody else has had it. It's just me.
Did you feel like you were going to die?
I did.
It must have been terrifying.
Before I even got here at home, when the ambulance came up, I was on my last breath. My oxygen was below 70.
Yeah.
So I was quite close to death.
Many blame those who, for whatever reason, have not had the vaccine.
What they don't understand is that it isn't just a question of protecting themselves. They're being selfish because they're taking up beds that need not be taken up. And that is putting more pressure on the health service.
Staff shortages are a big problem. Many doctors and nurses are off sick with the virus themselves. Some hospitals have had to call in the army to plug the gap left by absent medical workers. But there are signs of hope. Health authorities say the number of Omicron infections in London may now be past its peak.
For more, let's bring in our correspondent Charlotte Shelson-Pill in London. Charlotte, 150,000 lives lost to COVID-19. How are people reacting to this?
Clearly a very somber milestone here in the UK. And of course, there are different ways of measuring this death toll. One suggesting that it could in fact be even higher. Clearly extremely tragic, this milestone. Now, the Prime Minister has released a statement on Twitter. He said that coronavirus has taken what he called a terrible toll on our country. He said each and every one of those who died is a profound loss to the families, friends and communities affected. And he took the moment to really stress how getting the booster jab, getting the first and second vaccine is really the path out of this pandemic. Now, there has, of course, been criticism through the course of the pandemic over the government's handling of this crisis, and a spokesperson for the campaign group Bereaved Families for Justice, which supports families who've lost loved ones to COVID, has been very critical of this milestone. They have said that a public inquiry into the government's handling of the pandemic cannot come soon enough.
All of this questioning, Charlotte, as the country is also combating a wave of Omicron infections. How are hospitals coping?
There's no doubt that the health service here is under immense pressure. At the moment, hospitalizations and fatalities have started rising here. And what's very clear is they were already dealing with a backlog, the effects of months of this pandemic, with hospitalizations now rising, winter pressures, and crucially, staff absences fueled by this Omicron variant. This is a critical time for the health service. At the moment, as you mentioned earlier, here in London, the military, 200 military personnel have been sent in to try and support the health service, although, of course, that will not compensate for the sheer number of staff who are absent or isolating at the moment.
You know, as we heard in the report, authorities are hopeful because they believe Omicron infections may be past their peak. How would they get to that conclusion specifically?
It is extremely early days for that. Last week, we saw record case numbers, over 200,000 here in the UK. The last couple of days have seen a bit of a dip on that extremely high figure. But as I say, very early days to be saying that the UK is past the peak. You have to look at this regionally, of course. Here in London, perhaps case numbers aren't as high as they were. Other parts of the country, they are going up. And health experts, advisors to the government have warned that what will be particularly crucial is what needs to be seen is a reduction in cases in all age groups, particularly older age groups who we know are most vulnerable to this virus.
That's Charlotte Chalson-Pill in London for us. Many thanks.